let's go now to our last topic, which is your vein disorder, thrombophlebitis, deep vein thrombosis, and your varicose veins. All right. Thrombophlebitis, deep vein thrombosis, and varicose veins. And the mechanism of this is the same with the mechanism I mentioned before. When there is venous problem, you will always face venous stasis. Venous stasis, blood coagulation, clot formation. All right, venous stasis, blood coagulation, clot formation. Is this very dangerous? Will this be an emergency if in case there is clot? Yes, because a clot, which is a thrombus, can migrate and become a what? An embolus or an emboli. All right, so isa-isahin natin, dear nurses. So we have your thrombophlebitis. Thrombo. There is an existing what? Clot. Thrombus, okay? And existing clot, where? Inside your vein. And there is also existing what? Itis, phlebitis. There is existing what? Inflammation of your vein. All right. If the veins are inflamed, again, there is rubor, calor, tumor, dolor. Ayan. Ayan na naman tayo, ang cardinal signs of inflammation natin. And main problem is what? Aside for main problem, letter I. Aside from inflammation, ayan, itis nga, no? Inflammation, meron din kang clot formation. Kaya pala, in phlebitis, merong pain. Kaya pala, in phlebitis, meron pain. Unlike in deep vein thrombosis, pain is not present at first. Alright? Later part na lang si pain sa DVT. But in thrombophlebitis, there will be pain because there is inflammation. And what's that pain? That is your Homan's pain or your Homan's sign. Do you check this for clients after surgery? Yes. Do you check this for clients after giving birth sa mga mother? Yan yung pag-assess natin postpartum? Yes. Why? Because of what? Immobility. Immobility leads to blood stasis. Blood coagulation, paulit-ulit na lang si Ma'am Haya. What? Blood clot formation. All right? All right. How do we initiate or how do we assess for Homan's sign, dear nurses? Should you dorsiflex? All right. Paki-answer nga dyan sa Facebook live streaming natin or here in our Zoom. If the client has, how will you check for Homan's sign? Should you dorsiflex it or should you plantar flex it? Dorsiflex or plantar flex? All right, you should dorsiflex it. And where will you experience or where will you feel the pain? Is it in the hamstring or in the gastrocnemius muscle? It's in your gastrocnemius muscle. Very good. All right, again. Dorsiflex, just imagine, ito yung paa ko, dorsiflex. Pagka dorsiflex mo, may sakit dito. What is this? Example, this is my gastrocnemius muscle or my calf muscle. And if there is positive Homan's sign, then you should know that you should never massage the area. Because if there is positive Homan's sign, it is now confirmed that the client has thrombophlebitis, meaning there is a thrombus in the area. Therefore, if you massage it, the thrombus will migrate. Okay? All right. Negative Homan's sign, pag wala, okay lang bang i-massage? Pwede. Para nga hindi magstay. All right? If negative Homan's sign, you can massage it para magkaroon ng venous return. If there is negative Homan's sign, can you elevate it? Pwede. Alright, elevate it. Why? Kasi nga, it will promote venous return. Okay? But if there is positive Homan's sign, never massage kasi lilipat ang clot. It will become an emboli. Later, I'm going to tell you the complications. All right. What should be on the bedside? You should have your what? Tape measure. All right. Your tape measure. This is very important in your Middle East exam. When you assess if it's positive or negative, you should know your nursing intervention. Okay. Next, let's go to deep vein thrombosis. deep vein thrombosis. From the word itself, deep vein thrombosis. The thrombus, the clot formation, is not in your superficial veins, and it's in your deep veins. All right. The main problem is again thrombus or a clot in your deep vein, leading again to venous stasis. All right. If the blood is staying, there will be blood coagulation. That is why the Virchow's triad is what is manifested. So what is Virchow's triad? We have lots of triads in medical surgical nursing. And if you want to more about your different triads, Virchow's triad, Charcot's triads, Beck's triads, and the other triads, your shock triads, ayan, join us in the review. Okay? So we have your Virchow's triad, your VVV. Ayan. If you want to know more of the other V's na makikita mo rin sa iyong eye disorders, join us then in our review. So we have your venous stasis, that I'm talking here about the Virchow's triad. Venous stasis, kung tatanungin kita, alam mo na ang mechanism. Venal wall damage. Ma'am, bakit? If the blood is staying and the veins are stretching, do you think the wall could be damaged? Yes, and the damaging of the wall can lead to again inflammation of the wall, causing again phlebitis. So paulit-ulit, okay? Venous stasis, venal wall damage, making now letter V, blood. All right, blood. Pinilit lang ba? Pinilit. Blood coagulation. The VVV, if the blood is coagulating, it will form a clot. Clotting, all right, forming now an M. Bilay kapag na-move si clot. Kaya pala, in your deep vein thrombosis, we encourage the client to what? To wear your anti-embolic stockings. All right, your anti-embolic stockings. Question, dear nurses, anti-embolic stockings intervention is dependent or independent? It is a what? It is a dependent nursing action. You need a doctor's order for this one. We cannot simply tell the client, oh, bili ka ng anti-embolic stockings. No, it should have an order. All right. And another question in your Middle East exam is, how do you wear your, how and when do you wear your anti-embolic stockings? Anti-embolic stockings should be worn even before going out of bed. So when the client is on a supine position, example, this is the client. When the client is on a supine position, tell the client to elevate the legs. All right, the client is lying down, supine position si client. Tell the client to elevate the legs. Habang ina-elevate niya yung legs niya, doon mo isusuot. That is the time you will going to help the client to wear the anti-embolic stockings while the legs are what? Elevated. All right? Because if you're going to tell the client to sit down, dangle the foot, the blood will be pulled to the lower extremities. And when you put your anti-embolic stockings, what will happen? The blood will be locked in the area, causing venous stasis and blood coagulation again. All right? Supine position, elevate the legs, wear the anti-embolic stockings. Okay? Even before the client went out or goes out of the bed. All right. Next, we also have your anticoagulants. Anticoagulants, these are given to prevent further clotting. Is there an existing clot already? Yes. There is a thrombus already. That is why we will not give antiplatelet aggregates. We give the medication that will prevent further clotting. And that is what? Anticoagulants. This is your heparin and your warfarin. Heparin is an injectable. Warfarin is a what? It's an oral medication. And this is very favorite in the Middle East. Why? There are lots of clients who are taking warfarin and they are monitored every week or on a frequency for their INR and for their PT, prothrombin time, and the INR, international normalized ratio, because we need to check for the therapeutic level. I had patients with taking warfarin before, and this makes them candidate as well to have a nurse because it needs monitoring, all right? Anticoagulants, more on those in our pharmacology discussion. And finally, complication. Since there is thrombus, when the area moves, when you massage the area, for example, when that area nag-ambulate siya, no, causing movement, the thrombus can lead to emboli, it can go to your heart. Ayan, sa mga nasa Facebook Live natin, they're nurses. When the, alright, thank you for answering, no? Mga si Brianna, si John Carino, thank you. Ayan, for answering. Si Louie Manaxa. Ayan, join kayo later sa ating game. Okay, if the embolus goes to our heart, entering now the circulation of our heart. Naku, it is an emergency. Why? Embolus going to your heart can lead to what? Myocardial infarction, which can lead to what? Death of the client, MI. All right, abrupt cessation of blood flow to your heart. It's not gradual, it is abrupt, it is sudden, it is rapid, causing what? Necrosis, all right, causing heart attack. Next, when the embolus travels to your brain, nandito na tayo. Saan na ba ang aking pointer here? All right, heart, MI, brain. When the embolus travels to your brain, it will cause your stroke or your CVA, specifically your ischemic stroke. Not hemorrhagic, not hemorrhagic. It is what? Ischemic stroke. And finally, when the embolus goes to your lungs, it will go to your what? It will be called your what? Pulmonary embolism. Nasabi sa Middle East exam, if you have pulmonary embolism, wag kang mag-chest physiotherapy kasi gagalaw si embolus. Alright? Question in the Middle East exam, the client has DVT, complication pulmonary embolism, which should not be done on a client, but the client is coughing, the client has secretions, never perform chest physiotherapy because the embolus could migrate again. Okay? So that is our deep vein thrombosis. All right, and finally, varicose veins. All right, varicose veins is simply what? Weak valves, all right, weak valves, ang pangit ng sulat, Ma'am Haya, all right, or damaged valves. If the valves should be one way, pabalik lang tayo sa puso, no? If the valves are should be one way, what will happen if your valves are weak? What will happen if your valves are damaged? There will be what? Backflow. There will be what? Regurgitation. There will be what again? Stasis again. Paulit-ulit si Ma'am Haya, stasis. That is why in your varicose veins, if the blood is staying inside your vein, do you think the vein will stretch? Yes. The vein will dilate? Yes. The vein will become what? Tortuous. All right? Or your snake-like veins. Tortuous veins. All right, your veins will become tortuous. All right, they are snake-like, they are dilated. Ayan, they are full of blood, and usually the color is what? Purplish or bluish because it is what? Poorly oxygenated blood, purplish or bluish. All right, so what is our management here? You should elevate the part. Okay, you should elevate the part because this will promote what? Venous return. Elevate the part to promote venous return. Ma'am, if the profession or if the work of the client is a sales lady or if the client is a nurse in the OR or if the client is a policeman, always not policeman, traffic enforcer, okay? All right, always on a standing position, what will the client do? All right, it's okay if that's your profession or that's your work as long as you will have your rest. You will do flexing of your knees. Ayan, even if you're in the OR, no? Doing craniotomy, doing ORIF, all right? Doing your T-tube insertion for your gallbladder. So you can just flex so that it will still promote venous return. And when you get home and the client is at home or on a lying position, elevate the lower extremities, okay? And next, avoid crossing of knees because this will lock blood. Avoid prolonged sitting or standing and avoid constrictive clothing, all right? Because all of this will promote what? All of this will promote venous stasis. All right, so those are our disorders for your vein. All right, another test-taking strategy, dear nurses, is how to care for our body parts who has arterial insufficiency and who has what? Venous insufficiency. Always remember, ito ang aking technique, no? If it's an artery, is this an artery? Letter A, no? Artery, A. Ayan. Artery A, always lower down the body part. Again. Problema po ba sa artery ang oxygen? Yes. So lower down the body part, letter A, so that it will have oxygen supply. If you don't see in the choices or in the options the word lower down, check for the word dependent. All right. When you see in the options, put the extremity or the body part on a dependent position. That is now the answer, because lowering it is making it on a dependent position. All right. And for vein problem, letter V. Is this vein? Yan, letter V. You should what? Elevate it. Alright, pag sumasagot ka in your exam, pag vein, sabi ni Ma'am Haya, I should elevate it to promote venous return. Pag artery, I should lower it down, alright, to promote oxygenation. Another thing that you should consider, dear nurses, is that since this area will have problem, alright, specifically the artery will have problem in their sensation, there is paresthesia, there is paralysis, always protect, all right? Always protect the body part. Always protect the body part. So, when you protect the body part, always check the temperature of the water. Baka pala hot yan or warm yan. The client doesn't know. The client will have what? Burn. Okay, will be burned, all right? Protect the body part. So, aside from promoting circulation with that letter A, protect the body part. How do we protect? By what? Check the temperature of the water. Make sure that the client is wearing closed shoes. All right, closed shoes that has a good fit. Okay, not firm, not tight. It should have a good fit. It should not be open. It should be closed. So bawal ang sandals, bawal ang slippers. All right. Another thing, when cutting their toenails, all right, their toenails, the provider should be the one who will cut it. All right, we are not allowed, specifically for arterial insufficiency, no, we are not allowed to cut for their toenails. Only the provider, the doctor, will going to be the one who will cut the toenails. Principle, or the principle about protecting the part kasi hindi niya mararamdaman, answer that one. But in vein, the principle is about venous stasis, venous return, and don't let the clot become an emboli. Always put the principle or always answer based on that principle. All right. So that ends our discussion on arterial and venous insufficiency. Thank you for watching. Don't go yet, dear nurses, because we're going to have a game. And I don't know if you are able to what do you call this? Experience before how to play your Kahoots. Ayan, maybe some of you played Kahoot before. Let me just ask, hold on. If we will have, all right. If we will have a prize, Ma'am Rachel, for the one who will win. Ayan, who will win our Kahoot game. And everybody there in Facebook, you are more than 60 there. And here, you can join our Kahoot. So what you will do is just go to Google and type their Kahoots. Let me, hold on. Let me find. All right, just type in their Kahoot, K-A-H-O-O-T. All right, pakitype po, go to Kahoots. All right, punta ka sa Kahoot, click mo doon, then click mo ay join the game. All right, join the game. For those here in the Zoom, ayan, punta kayo sa Google. And since if you are using your laptops at the moment, you can be able to see the questions here. All right, na mapapakita sa laptop, then use your mobiles to answer the question. Okay? But if you are using your mobile now to watch, I'm going to read aloud the question at pipili ka ng sagot mo based on the color codings, okay? Based on the color coding. So, punta ka na sa Kahoots, and then, when you are now in the Kahoot, you will just click there the join game. Let me check in my end here. Kahoot. All right. And then it will now require you a game pin. All right. This should be the game pin. Hold on. All right, so let me just announce here, okay? According to Ma'am Rachel, the prize, all right, for the winner of this Kahoot game is discounted online review enrollment. Instead of 6,400 for the enrollment, the winner will have 1,500 peso discount. All right, so join na sa ating Kahoot. All right, we are now waiting for players. Can you please type in this game pin that you can see here on your screen, 1764821. Have 1, 2, 3, 4 years. Right, we'll give like 5 minutes for others to join. Yan, pag nadi-disconnect kayo or pag sometimes when you change screen sa inyong mobile, nawawala siya. So reconnect lang kayo with the same game pin. Alright, thank you sa mga sumasagot sa ating live streaming there. The one who answers the yung mga tanong ko kanina, no, the stroke, the MI, the pulmonary embolism. Ayan, so marami na. Still have 4 minutes. Ayan, to wait for players. Huwag na kayong aalis sa screen, okay? Para hindi kayo malalag out sa game.
I'd like to add, Miss Haya, that if ever, whoever will be the winner, you can use this discount for your NCLEX review or Middle East online review with IPASS Online Academy. So you will get 1,500 pesos for the discount, either for the NCLEX or for the Middle East. So join us in this game. So you will get 1,500 pesos.
Ayan, sayang yung 1,500. Ayan, more than 100 dirhams naman na yon sa UAE. Ilan ba yun sa Riyal? Ayan, so sayang. So join us.
How many questions do you have, Miss Haya?
Only have 10, ma'am, and they are very easy.
Yeah, it's just very easy, guys. So join na. Can we instruct them how to join this one again, Miss Haya, while we are waiting? Paano po sila mag-join?
Ayan, just join, just go to Kahoot, type in sa Google yung Kahoot, K-A-H-O-O-T, right? Then it will require you a game pin. Okay, and you just need to put in this game pin, type in there 1764821. All right, sa game pin natin. And you will have have choices, okay? So meron kang 5 items true or false and 5 items multiple choice. Maraming makakakuha ng tamang sagot. However, the fastest one, ayan, yun ang irarank ni Kahoot mamaya. Okay? Hindi kami ang nag-rank. It's the Kahoot. Alright, Kahoot site who will rank who is the winner. So we have here MKVT, Cams, the Destroyer. Hala, may the Destroyer dito. Si Ella, Dabi, Jem. Ayan. So we have Misty, Chris, Mad Salutes, Itachi, Jack, and May, Adele, John Oliver, and Agatha.
So Roque here is asking if I can join po 1,500 Gcash na lang po if mananalo. Already enrolled at IPASS Online na kayo. Okay, no problem. Join us. Let's just have fun. So if ever that you will be the winner, then we can transfer the Gcash of 1,500 amounting to 1,500. Join us. Let's just have fun, guys.
Okay, so 1 minute. Ayan, we are almost 50 here in Facebook Live. So marami pang pwedeng mag-join. Just just try. Malay mo, ikaw pala yung mananalo. Sayang naman si 1,500. If you are there in Virginia or in the other, or abroad, you are in the Middle East, ayan. So you can have a discount pa rin. So just, ano bang gagawin nila, Ma'am Rachel? Screenshot nila or they will email?
Yeah, I will send the information after we will know who will be the winner.
Okay. All right. So let's start.
Okay, let's start.
All right. Let's start. 30 seconds to answer for the true or false. All right. And 1 minute and 30 seconds or 90 seconds to answer for the multiple choice type. All right. Madali lang to, guys. Pabilisan. At syempre, dapat, kahit mabilis ka, dapat tama pa din. Alright, let's start. Alright. 3, 2, 1. Alright. First question. In an arterial insufficiency, a nurse will observe pallor, edema, and gangrene formation. True for blue, false for red. In arterial insufficiency, a nurse will observe pallor, edema, and gangrene formation. True, blue, or false sa red. 8 answered, 8 seconds left.
Somebody here is answering from our webinar. Ma'am Eva, doon po tayo mag-answer sa yung in-instruct ni Ms. Haya na way. Doon sa Kahoot talaga, I think so.
Ayan, sa Kahoot tayo, ma'am. Kahoot, punta ka ng Google, type mo Kahoot, tapos it will require a game pin. However, I cannot go back for the game pin. Ayan, nakastart na kasi tayo ng game. Alright, so, okay. The answer here is false. Only one got the correct answer. Sabi dyan, pallor, edema, and gangrene formation. Which is the word that makes it false? It's the word edema. Kasi sa artery, walang edema. Sa venous ang edema natin. So, let's see who is the one. All right, Chris. Okay, Chris got the correct answer. It's okay. 9 more questions to go. Question number 2, true or false? In a venous insufficiency, a nurse can be able to assess ulcers in ankles, redness, and increased calf circumference. In a venous insufficiency, you can assess ulcers in ankles, redness, and increased calf circumference. 10 seconds. All right, 11 answered and the correct answer is true. Tama yan, may ulcers ka talaga sa ankles, may redness because of the stasis, at increased circumference because of the inflammation. So let's see. Cams is the first one right now. Maraming humahabol. Let's check pa rin. Remember, pabilisan pa rin ito. True or false? Third question. Intermittent, sorry for that error. Intermittent claudication is a common complaint of a client with arterial problem due to blood stasis in the area. Due to blood stasis in the area. Intermittent claudication is a common complaint of a client with an arterial problem due to blood stasis in the area. Ayan, 12 seconds. Common complaint of a client. All right, the answer is false. Bakit po false, Ma'am Haya? Intermittent claudication, tama. It is a common complaint sa arterial. Due to blood stasis? No, it is due to what? Poor oxygenation. So this words blood stasis make the statement incorrect. Let's see. Sino humabol? Alright, CAMS. Ayan, humahabol pa rin yung iba natin. CAMS is still the first one here. Next. Question number 4. Intermittent color changes of the hands is common in thromboangiitis obliterans and should be reported immediately. True for blue, false for red. Intermittent color changes of the hands is common in thromboangiitis obliterans and should be reported immediately. True or false? 10 seconds. Ayan, habol. We still have 3 seconds. All right, the correct answer is false. Bakit? Intermittent claudication is common not in thromboangiitis obliterans. It's common in what? Raynaud's disease. It's common in Raynaud's disease. All right, the answer is false. Let's see. All right, Misty is now on the lead. All right, Habol, we are now on question number 5. A client with positive Homan sign should refrain from massaging the part to prevent embolus formation. A client with positive Homan sign should refrain from massaging the part to prevent embolus formation. Blue is true, red is false. Blue is true, red is false. All right, the correct answer is false. Bakit? Refrain from massaging the part. Okay, sorry guys, the answer is true. The correct answer is true. Mali ang aking na-click dyan. A client with positive Homan sign should refrain. Tama yan. Hindi dapat siya mag-massage sa area to prevent embolus formation. Okay, so yung 14, hala, paano ito? Yung 14 ang merong tamang sagot. All right, check na lang natin mamaya. May tally sheet naman mamaya. All right, so we are done with the 5 items, true or false. Let's go now to the multiple choice type. It is 90 seconds now, guys. Okay? Okay, check natin. Breaker just drop in their answer streak of 3. All right. Let's go now to question number 6. Upon assessment of a client with thromboangiitis obliterans, you will see changes in what anatomic areas? Upon assessment of a client with thromboangiitis obliterans, you will see changes in what anatomic areas? Red is neck and back, yung red na option. Blue option is fingers and palms. Yellow option is groin and knees. And green option is legs and feet. Upon assessment of a client with thromboangiitis obliterans, you will see changes in what anatomic areas? Neck and back sa red, fingers and palms sa blue, groin and knees sa yellow, and legs and feet sa green. Yan, haba-haba pa ang time. You still have 45 seconds. All right, 30 seconds. All right. Last 15 seconds. So, mahaba pa lang 90 seconds. So, mamaya. So, next question, you can analyze more. Okay, so what is our answer? I hope everybody will get the correct answer. And it is All right, 11 got the correct answer. It's legs and feet. Remember, thromboangiitis obliterans is an arterial problem at ang madadamage or ang part na walang oxygen ay ang distal, legs and feet. All right, let's see. All right, John Oliver is on the lead. Let's go now to the next question. All right, question number 7. All of the following are manifestations of Berger's disease except. All of the following are manifestations of Berger's disease except. Red option, cyanosis and paresthesia. Blue option, ulcers and burning pain. Yellow option, intermittent claudication and ulcers in toes. And green option, grade 3 pulse and tortuous vessels. Okay, option red, cyanosis and paresthesia. Option blue, ulcers and burning pain. Option 3, intermittent claudication and ulcers in toes. Option green, grade 3 pulse and tortuous veins. We are looking for the except. Okay, it's the negative statement. It's the incorrect manifestation of Berger's disease. Ay, you still have 25 seconds. Right, habol pa sa mga habol. 12 pa lang ang nakasagot. All right, and the correct answer is color green. And 10 got the correct answer kasi tama. Okay, sa Berger's disease, wala kang grade 3 pulse. Kasi sa Berger's disease, meron kang narrowing because of the inflammation at wala kang tortuous vessels because tortuous vessels is for varicose veins. All right. Good job, good job. J-O-O-B, good job. Ayan, so you have Jack. Okay, Jack is on the lead right now. Nag-iiba ang ating number 1. Question number 8. Which of the following is a conservative manner of foot care of arterial problem? Ano daw ang gagawin? Which of the following is a conservative manner of foot care of arterial problem? All right. Red option, vigilant inspection and lubrication of the feet. Blue option, wearing firm, supportive casual shoes. Yellow option, daily bath using warm water. And green option, applying anti-embolism stockings before getting out of bed. Again, question, which of the following is a conservative manner of foot care of arterial problem? Red, vigilant inspection and lubrication of the feet. Blue is wearing firm, supportive casual shoes. Right? Yellow is daily bath using warm water. And green is applying anti-embolism stockings before getting out of bed. All right? You still have 25 seconds left. All right, 15 already answered. Habol pa yung ibang sasagot. Ito palang pin, nasa ilalim pala. Sorry. 1764821. All right, and the correct answer is red. Ayan, and 6 got the correct answer. Let's see, bakit red? Let's eliminate the other option. Tingnan mo ang blue. Wearing firm, supportive casual shoes. We said that it should be closed shoes. It should not be firm. Ayan, pag sinabing firm, matigas, no? Masikip. So, it could lock the circulation. Dapat good fit. Alright? Number 2 or, blue option is incorrect. Mali rin ang yellow option kasi daily bath using warm water, no? Warm water is okay. However, there is a better answer for that. So, 2 options possible correct, but we will choose the best one. Next, yung green, applying anti-embolism stockings before getting out of bed. It is not for arterial problem. Green is not for arterial problem. It is for venous problem. All right? So our answer is vigilant inspection. When you say vigilant, this is keen observation. I-inspect mo, baka meron na pala dyang mga tawag dito, wound that are not healing, and lubrication of the feet because the feet could be dry. There is dryness kasi nga lack in circulation, wala nang moisture. Alright? Correct answer, red. So check natin sino ang nangunguna. Alright. Up 3 places. Alright. Ibig sabihin, yung mga nakasagot ng tama, yun yung mga nasa lower part. Alright. Next, number 9. Which of the following history will lead to peripheral edema and is a priority to be evaluated? Which of the following history daw will lead to peripheral edema and is a priority to be evaluated? Red option, a 60-year-old male client with hypertension taking furosemide for 3 years. B option, a gravida-3 mother and is now in the 3rd trimester of pregnancy. Yellow option, a 33-year-old typist with type 2 diabetes. And green option, a 51-year-old male client with cardiomyopathy taking digoxin. All right. Sino daw, or which of the following history daw ang maglilid to peripheral edema? Si red ba na may hypertension taking furosemide? Si blue ba na gravida-3 on the 3rd trimester? Si yellow ba na 33-year-old typist with type 2 diabetes? Or si 51-year-old male client with cardiomyopathy taking digoxin? Ten seconds left. All right, 5 seconds to answer. All right, and our answer is, it's blue. Ayan, and 7 got the correct answer. Let us eliminate their nurses. Let's eliminate. Bakit si red hindi siya magkakaroon ng peripheral edema, will not lead to peripheral edema? Because the client is already taking furosemide, which is a diuretic. Why green? All right, it will not develop your peripheral edema because the client is already taking digoxin, which will decrease the heart rate but increase the strength of contraction of your heart. Si yellow option, it will not lead to peripheral edema kasi typist siya, hindi naman siya yung naka-prolonged standing position. All right, so gravida-3 because of the impediment of the enlarged uterus to what? Venous return. This enlarged uterus impedes venous return. All right, congratulations. All right, still on the lead si Jack. Ayan, and last question. If a diagnosis of thrombophlebitis was confirmed, other than the complaint of pain, the nurse will most likely detect. If a diagnosis of thrombophlebitis was confirmed, other than pain, the nurse will most likely detect red, left calf circumference 2.5 larger than the right. Ayan. Swelling and redness of the right leg, a decrease in the right pedal pulse or loss of hair on the lower portion of the left leg. All right, what's your answer? There is thrombophlebitis na confirm na daw, assign daw sa pain. Anong next mong makikita? Left calf circumference 2.5 cm larger than the right, swelling and redness of the right leg, decrease in the right pedal pulse or loss of hair on the lower portion of the left leg. All right, still have 25 seconds to answer. All right, 10 seconds. Then we'll see later on the tallying because of the 5th question na incorrect yung napili kong correct answer. All right, very good. For the 9 person who got it right, swelling and redness of the right leg. Why? Because of thrombophlebitis, you will expect rubor, calor, tumor, dolor. So meron ka ng swelling, which is your tumor. Meron ka pang redness, which is your rubor. Pwede rin naman si option number 1, left circumference larger than the right one. Kaya nga we need tape measure, but more manifestation kasi kay blue option. Okay, so thank you very much. Let's see now. This is our podium, but I'm going to recheck, ha? Third, si Jack. Ayan, this is kasi based on the pabilisan. Even though you got the correct answer, still the pabilisan part. All right, Misty got 6 out of 10. Ayan, pero check natin si Misty kung anong sinagot niya doon sa 5th question. Pag sumagot pa rin siyang tama dun sa 5th question, Misty is our winner. Okay? Hold on. Let me just see the tallying here. Let me just view the full report. All right. Okay, hold on. It's loading. Okay. Nasaan na ating full report? Ito, players didn't finish. Ayan. Hold on. See more. All right, Ma'am Rachel, I will just see the full report here. Who is the winner?
Okay, Miss Maya.
Okay po.
Sorry. Sorry, I have other friends are here in the office. Sorry, nakalaan kasi tayo, guys. So while Miss Haya is checking, the report, so let me just also share to you what do we have in IPASS processing for our Middle East online review. So for our Middle East online review, this is our program. So we have our online live class wherein it will be delivered live during the scheduled classes, and it will be 2 months duration for the program, but you are eligible to attend the program for 6 months. So that's what you are paying for. So you will also have your downloadable handouts whenever you will have your class. So you can download those handouts before your class will be discussed. And of course, you can join with us wherever you are. And if ever that during the live class that you are not available during the time, so you can still access your online learning platform 24/7, guys. So whenever you have errands or busy po tayo dahil nag-duty, so you can still access that. So our enrollment fee will be 6,400. And then you are going to pay for the remaining amount after a month. So that's the remaining 6,400. So our total package is 12,800. So every duration for our cycle will be 2 months. And then that's 6 months unlimited access because your enrollment fee will be valid for 6 months and we have 124 hours. So you will get more of this kind of discussion comprehensively during your online class. So guys, we look forward to having you in our online review program. And also if you ever that you are interested on our NCLEX online review class, we also have that. So we both have the NCLEX as well as the Middle East online review. For the NCLEX naman, we also have it online, live class pa din po. We also are giving the roadmap to NCLEX. You have your downloadable handouts. Of course, you can study anytime, anywhere. So for our NCLEX, it's usually 3 months the duration, but it's 1 year unlimited access for you guys. And we have 68 hours of discussion. So for our NCLEX program, the enrollment fee will be 10,000, and then you are going to pay for the remaining amount of 10,000 after a month. And then you will also have your discount for the processing if you are already have done or you are already you already have your ongoing NCLEX processing with IPASS processing, and then you want to enroll for our review program, so you can also get the discount. So just check with us, inquire to us through our email address at inquiry@ipassprocessing.com. So Miss Haya, is it already okay?
Yes, ma'am. I already confirmed who is our winner. Let me share it again. Share ko lang, no?
Wow.
All right, so I checked because Jack got 5 out of 10, Ella got 6 out of 10, and Misty also got 6 out of 10. However, Ella chose false in question number 5, and Misty chose true, and the correct answer in that is true. All right, therefore Misty got 7 out of 10. Congratulations. Congratulations on Misty.
Okay, Misty, congratulations for winning the 1,500 na discount po if ever that you are already enrolled in our Middle East online review program or in the MOH online review program. So we can just give the discount for example, for the processing, or if you want it transferred to you via GCash, we can also provide that to you, so we can transfer it. So Misty, you just send to us an email at inquiry@ipassprocessing.com. Let us know that you are the winner, and then let us know how do you want it to be transferred to you. Okay, so thank you very much, guys. Well done, everyone. And I know that you learned a lot from this discussion. So if you want to know more, if you want to attend more of this comprehensive discussion for the Middle East online review or the NCLEX online review, so we have it for you guys. So thank you very much for sharing to us your precious time on this discussion. And thank you very much, Ms. Haya, for that in-depth discussion on the arterial and venous insufficiency. So by next week, we will also have our live Facebook discussion, and that will be for the NCLEX online review, guys. So stay tuned, and please participate as well on our practice questions that we are giving on a weekly basis via our Facebook page, that's IPASS Processing. So thank you very much po sa lahat, and have a great day, everyone po. Thank you.
Bye, everyone. Thank you.